So about 4 years ago, I started having a lot of pain in my back and then a little bit in my leg, and I thought it really was my back, and it started affecting what I could do. And then it just got worse and worse. And so when I went in and saw Dr. Hickman, and he said, yeah, your hip is so bad, you need a hip replacement. And I thought, are you kidding me? I've been so active my whole life. I mean, I've run marathons. How could I need a hip replacement? I'm Michelle Todd. I am a fitness instructor. I'm a grandmother. I'm active every single day. I either teach a lifting class or a cycle class. There's not a day that I don't do some kind of physical activity. If I couldn't do that, I don't know what I would do. I don't know if I could mentally get through a day.
I'm Josh Hickman. I'm a part of Mountain Orthopedics, which is a large subspecialty orthopedic group. I've been doing this for 20 years. I was fellowship trained in Chicago. Patients like Michelle are the reason I went into orthopedics, and particularly joint replacement. Clearly, the implants are the most important part of a hip and knee replacement. Whether I'm doing a primary knee replacement that allows them to ski, or a hip replacement where a patient can be living a normal life where they don't notice that they've even had a hip replacement performed.
So my first hip replacement was great. I was back doing what I loved, and that summer I water skied as good as I ever did, if not maybe even better. It was great. And so then in about a year or so, I started feeling the same kind of twinge on my other side. And so I knew then that it was my other hip. And so I put it off again for a little bit. But then my daughter had a baby, and I was carrying this baby around, and every time I took a step, it hurt. Or I was worried my leg was gonna give out, and I'm carrying a baby, what am I gonna do? So I knew I had to go get my second one done. Well, it's been a long journey from the first hip 4 years ago to the second one now, and I'm back to all of my activity. I can lift, I can cycle, I can play with my grandchildren. I am extremely grateful for the whole process, for Dr. Hickman, for Ortho Development, that they made such a great implant, because it gave me my life back.
Yay!